As men grow older, maintaining sexual health and performance is near the top of most men's minds. As men enter their 40s and beyond, they start to become more susceptible to a number of different health conditions that can impact sexual function, including testosterone deficiency and diabetes. Did you know, however, that there are actually many medications that can either inhibit your libido, inhibit your sexual function, or both? Men don't realize how commonly that medications are the root cause of erectile dysfunction. In fact, research suggests that sexual dysfunction is the result of the drugs taken by the male patient in as many as 25% of erectile dysfunction cases. We all know how important sex is to a happy and healthy relationship. If you are having trouble generating interest in your partner, or if you can't seal the deal, you should talk to a physician and find out the root cause of your dysfunction. In many cases, erectile dysfunction is a sign of deeper underlying problems, and it is possible that in the case that your medications are altering your sexual performance, there are steps that you can take to restore your sexual health. In some cases, changing drugs is all that's necessary. In other cases, erectile dysfunction could be a sign that you need further treatment. Don't be afraid to talk to your doctor about any sexual issues that you may be experiencing. Your doctor is trained to consider all of your health issues with care and consideration. And if you are having trouble in your sex life, your doctor may be the professional, single most equipped to help you overcome your erectile dysfunction or lack of libido so that you can restore your intimacy with your partner. Even if drugs aren't causing your erectile dysfunction, it benefits you in the long run to rule out your medications as the cause of your sexual distress before you turn to erectile dysfunction medications, such as Viagra or Levitra, or testosterone hormone therapies, such as testosterone patches, creams, and injections. The following are some examples of medications that can contribute significantly to sexual distress in some patients. Of course, if you are taking any of these treatments, it is important to talk to your doctor and get his or her consent before you quit taking any medication. Usually, your doctor can alter your medication regimen in order to restore your sexual function, while still treating any underlying conditions that may be afflicting your health and wellness. Statins are prescribed in order to treat patients that have unhealthy cholesterol levels and need help controlling their cholesterol in order to protect and safeguard their heart and cardiovascular system. The problem with suppressing cholesterol activity, however, is that your body won't produce sex hormones as efficiently. Although most of the time we hear about the bad things associated with cholesterol, especially LDL cholesterol, cholesterol is also the core component of all of the sexual hormones, including testosterone. Without sufficient testosterone, you won't be able to sufficiently maintain an erection, and your libido, as well as the pleasure that you derive from sexual activity, will diminish severely. Another relatively common symptom of statins in particular is that it can cause muscle atrophy, which leads to both joint pain and weakness. As of 2002, there is undeniable clinical evidence that both fibrates and statins can lead directly to erectile dysfunction. A study published in 2009 further discovered that statins reduce the ability of both sexes to experience full sexual pleasure, including orgasm. Interestingly enough, the suppression of sexual pleasure correlated strongly with LDL cholesterol levels themselves. There are millions of men and women across the country that take fibrates and statins for coronary artery disease. For patients that don't have exceedingly high cholesterol levels, it may be possible to avoid fibrate and statin drugs altogether if the patient adheres to a healthy diet regimen and supplements their diet with high doses of vitamin B6, folic acid, and sublingual B12 each day. For patients with somewhat high cholesterol, it is recommended to take 200 milligrams of B6, 800 micrograms of folic acid, and 1 milligram of B12 each day. Blood pressure treatments are important for patients with hypertension and high blood pressure because they help keep blood circulating effectively throughout the body without putting too much strain on the heart. For patients with atherosclerosis, heart disease, or other diseases which impact the heart and blood flow, these treatments can benefit patients significantly. Unfortunately, any drug that impacts blood pressure can also impact sexual health, reducing the pleasure associated with sexual activity, as well as the ability for both sexes to be sexually ready for sex. In particular, blood pressure medications can inhibit both erections and orgasms. For women, vasodilation can lead to issues reaching orgasm, as well as lack of libido and issues becoming fully lubricated for sex. While it is true that every medication that affects blood pressure can inhibit sexual function, there are 3 classes of these treatments which impact sex drive and function the most: alpha blockers, beta blockers, and diuretics. The reason why diuretics impede sexual function is not only the result of the way that they alter blood pressure, but the way that they alter zinc levels in the body. Zinc is an integral component of testosterone. Beta blockers, on the other hand, alter sexual function in 3 different ways. They suppress testosterone activity, they inhibit nerve signals which control arousal, and they depress and sedate the patient. There are a variety of blood pressure medications which can effectively treat hypertension, and each has the capacity to inhibit sex drive and function in its own way. If the drug that you are currently taking is producing unwanted sexual side effects, ask your physician if you can switch treatments. For example, benzothiazepine calcium channel blockers are the least likely to lead to sexual dysfunction of all of the hypertension medications available today. There are a lot of reasons why patients take antidepressants, although the name would suggest that depression is the only reason. Other treatments for which antidepressants have been found effective are chronic pain, OCD, eating disorders, and anxiety disorders such as general anxiety disorder. Antidepressants can even be used to treat menstrual cramping and to help patients quit smoking. There are a number of antidepressants which all treat these conditions via different pathways. Common antidepressants that are used now or have been used in the past are selective serotonin reuptake inhibitors, SSRIs, MAO-I inhibitors, tricyclics, lithium, and dopamine blockers. Antidepressants are powerful medications that alter the way that the brain responds to chemicals associated with neurological function, including norepinephrine, serotonin, and acetylcholine. Antidepressants increase the activity of serotonin in the brain, but can impede serotonin activity in other parts of the body. The way that these 3 hormones are affected by antidepressants can lead directly to erectile dysfunction and loss of libido. For example, one antidepressant known as reduces sex drive in 18% of patients and stops male ejaculation in 40% of patients. 15% of patients that take this antidepressant experience full impotence. Often in the case of antidepressants, sexual function can be restored or vastly improved simply by adjusting the dose of the medication. Some patients may benefit most by changing from a drug treatment to another form of therapy, such as talk therapy. Because there are a wide variety of antidepressants, many patients choose to simply switch medications in order to restore sexual function.